When I've given lectures on this, I call it the sixth vital sign. I think it's something that we should probably check, because if there is, sort of lower levels, that may tell us about something else going on. When men come in for fertility evaluations, a lot of times we do diagnose, these new medical problems. Sometimes we diagnose cancer, sort of alluding to some of the questions that you've asked, diabetes, and some other, very significant genetic conditions as well. And, the first way that we would identify it is reproductive failure, because their sperm counts are low, and other things. So it is something I think that it's very important, I think, for people to realize. And it would be great, I think, another, I think, advantage to like the Centers for Disease Control, for example, to start tracking it.
Would it be a good idea for males in their 20s and 30s to get a sperm analysis, just to have a baseline? I confess I'm 47 now. One thing I wish I had done in my 20s was to get my blood hormone profiles and lipid profiles done when I was in my teens and 20s, because I'd have something to compare to. I started doing that in my mid-30s, and I'm so glad I did, because I can now compare to my mid-30s levels. I started including sperm analysis about 8 years ago with the intention of freezing sperm, and did that because I was also reading at that time about the increased risk of autism in offspring of males older than 40, something that I really would like your take on. It seems like it's inexpensive enough to do a sperm analysis. I think now people can get it done at home. They have mail kits, although I don't understand how the motility could be maintained if you're mailing your sperm back at room temperature, or it's heading through the post office. Now everyone's imagining all these sperm traveling through the postal service. They're out there, folks. Yeah, what are your thoughts? Should people invest I think it was a couple $100 to get a sperm analysis, more costly to get the DNA fragmentation, then you get up into the low thousands. But if people have the disposable income, is it a good idea for them to do?